doctor. This is the Indian-American doctor who's returned to roots to assist in the COVID fight, Dr. Harmandeep Singh Boparai, who was working as a frontline worker in the United States and currently treating COVID-19 patients here in Amritsar. So that is yet another inspirational story that we're going to be focusing on. Good morning, Dr. Harmandeep. Thank you for speaking to us and taking out your time. Frontline workers have had a very, long journey through this past 1 year or so. It's been difficult indeed. You were fighting the pandemic and helping people in the United States. You're back home serving the people here. How has this journey been, and what exactly is going on as of now in your journey?
Thank you for having me. You're right. It has been a very tough year for frontline workers worldwide. When the pandemic first wave hit New York, a lot of us were caught unawares in terms of the intensity of what this wave entailed. We did not know enough about COVID at that point. We were very far away from vaccines. So it was a joint effort by some very brave and dedicated souls, and it took its toll. We had to work long hours. We were able to make some impact. And in the process, we also lost some people that were giving up, in some cases, their retirement to come back and fight in the hospitals to save people. One of the things that we must also consider is for frontline workers, for doctors, nurses, technical staff, really everyone who's helping this entire process, there is a lot of mental fatigue and mental trauma that sets in over a very prolonged period of time, which we also need to be cognizant of and take care of. And I've returned to India now. This is where the fight is, in my home state of Punjab. I've been helping institute some protocols that we learned, some of the lessons in the US, and trying to build capacity both for this surge and anything we might have coming forward.
All right, Dr. Harmandeep, now United States also certainly has passed through very difficult times indeed. The vaccination program there is being appreciated. What made you get back to India? Was this a decision taken by you, or were you in India when the country was sadly hit by this atrocious wave?
Both. When I was coming to India towards the beginning of last month, my intention was to work with the hospitals in my home city in order to start building capacity for a potential next wave, but also from the lessons we'd learned worldwide when systems are overwhelmed. What I did not expect was that that wave would come this soon. In the month of April itself, we started seeing such a massive surge in cases, and then we had to shift our role, and I had to shift focus into actually tackling this particular wave. As for why I've come to India, it is my home. I care about it. I grew up in Punjab, and this is where the need is right now.
That's great work there that you're doing, Dr. Harmandeep. For also, as per your observations, you've been treating patients in your hometown, Amritsar. What do you make of the situation? Our healthcare system certainly overburdened at this point in time. A few days back, we were seeing a lot of cries about, shortage of oxygen supplies. So the center, along with states, are now working on that. But still, there are several sad stories that we're coming across day in and out, and the situation is certainly very, very serious.
The stories have been very sad, and even one life lost is, if it is preventable, too many. Now, there has been a great effort by the administration of many places, including my home city, in order to streamline the efforts, and now the oxygen supply is pretty consistent over the last many days, at least for the hospitals that are tackling the COVID patients. Of course, taking care of people who are in a caregiver role while their loved one is suffering has been one of my big things I've been promoting both in New York as well as here, because the toll it takes is for the whole family and the society, not just for the person suffering. And so hopefully, as now cases recede in some parts of the country, we can take stock of all of these things and really unite in our ongoing efforts.
And the death toll is one thing that is still a huge concern nationwide this time, Dr. Harmandeep. As for the vaccination process in India is concerned, what are your observations and what do you think needs to be done? What more needs to be done? Of course, now 18 plus age people are also in the vaccination bracket. They are also getting inoculated. There are certain challenges that we're facing daily, but we're trying to overcome those. What are the key takeaways and perhaps something that you've picked up from how the inoculation drive in the United States was carried out?
Right. So I'll speak about the US and then about my personal experience here. In the US, as the world now knows, the new administration has instituted a very aggressive vaccination campaign, and so many parts of the country have seen a very healthy percentage being vaccinated. There is still some vaccine hesitancy in parts of the US, and that is currently they're trying to address it. In India, I think that we are the pharmacy of the world. India has the capacity to vaccinate its citizens. I'm very happy that now 18 plus has been approved for the vaccination drive. And the streamlining of these processes and supply chains, as well as trying to get the timely delivery and administration of vaccines, as well as the campaigns to raise awareness for this kind of vaccination, will be very helpful, as they are already happening and scaled up, in order to give the right information to the people so that if they're eligible and don't have any risk factors, they can get vaccinated and we can contain some of this spread going forward.
Because that is one way, and the only way as of now, at least, of what the health experts can read into this COVID-19, the coronavirus. Dr. Harmandeep, before I let you go, we've been focusing on the positive messaging all through this journey. And what's your message to the viewers, to the citizens of the country? Just remind them once again, mask up is what we need to do, and also how vaccination is the need of the hour. Your last message before we let you go.
Absolutely. One of the things that I must stress is that we as Indians, we are a resilient people. We can get through this. And sometimes what we know from public health around the world, the simplest interventions are the most effective. Wearing masks whenever you're outside or not in the immediate vicinity of people you're living with, and even simple hand washing techniques, sanitizing, but hand washing, staying away from going out, especially in groups, if you can stay in that kind of an environment. And we will see the other side of this together. There are some very brave people helping, but even staying at home right now and keeping yourself safe is a great help to the entire country. And hopefully we have better days ahead very soon.
Absolutely. And vaccination or no vaccination, the masks must be on, and we should keep following all the COVID-19 protocols. That's one instruction, one recommendation being given by all our healthcare experts. Dr. Harmandeep, thank you so much for speaking to us. Appreciate all your efforts. Thank you for your service.
Thank you for having me, and all the best to everyone. May you be healthy and safe.